I'm Diane Wolinia, and my husband Neil Wolinia suffered with lung cancer before he passed.
My name is Walter Walkway. One of the thoracic surgical oncologists here at Banner. Happy to be here.
What are some strengths you saw Neil had during his battle with cancer?
The strength that he had was that he's a very disciplined man and very positive and very open. And so he was open to whatever forms of medicine, treatment, holistic, the regular doctors that you would go to. We eventually went to kind of a holistic doctor that approached the diet and some natural things and some like IV type of supplements for him. And when he had home care, he was always very, very much a part of trying to walk, trying to strengthen, trying to get outside for sunshine and do all the things that were necessary to be well.
What are some evident weaknesses you saw during his battle?
Well, he became quite fatigued, and even though he is a really disciplined and very optimistic person, his physical strength was so depleted that it was difficult to eat, difficult to do the physical things that need to be done, like maybe go outside, get some sunlight, sit outside, it was just hard to get around.
What were common symptoms of his cancer/medications?
Well, at first he was taking medication for the lung pulmonary fibrosis, and that was a very strong medication he'd been on for a while, and it was supposed to keep the fibrosis in his lung, the scarring basically, away. And he was on that, and it kind of disturbed his appetite and everything. And then he had reflux, really bad acid, and so they had to do surgery on him for that. And after that is when there was a tremendous weight loss and difficulty swallowing and sometimes breathing.
What effects did his battle with lung cancer have on the family during and post-battle?
Well, the biggest disappointment and obstacle was that we thought he just had pulmonary fibrosis, but the things that were happening to his body and in response to the medications weren't adding up. He could not gain weight, he could not resume eating well. And so it was like a mystery that needed to be solved, like why can't he get better? And they didn't want to take biopsy because it would scar the lung. But finally, that was the only thing they thought might be happening. So they did do the biopsy of the lung, and he was in the hospital at that time when they finally gave us the diagnosis that it was cancer.
What obstacles did you run into while dealing with his cancer?
Some of the obstacles were, first of all, that it wasn't identified initially as his first affliction, so we're focusing more on the pulmonary fibrosis and the scarring. And so when he did find out that it was cancer, then we were trying to have him regain his weight and be able to be at a weight where he could battle everything. And so it was hard to eat, it was hard to drink, even doing really concentrated food additives and very holistic and juicing and all kinds of things like that, but it was still a great obstacle with getting the nutrition into him.
What are the struggles you run into when dealing with lung cancer patients?
Good question. I think initially what it really boils down to is education. A lot of patients are not really educated on what lung cancer is, how it's diagnosed, how it progresses, the treatment options. So what I take pride in, particularly when I see patients in the office, really, is just kind of start with the basics as far as what lung cancer is and how it comes about, what stage they're at, and then the treatment options. I try to emphasize to them that the treatment options are tailored to them, tailored to their stage, how aggressive the tumor is, and ultimately what they would desire for their goals of care, and ultimately focusing on comfort a lot of times for the patients.
How do you manage patients who aren't responding to treatments well?
Yeah, so patients, initially we stage the patients. If they have lung cancer, we give them a particular stage from stage 0 to stage 4. Stage 4 meaning it's metastatic likely. At least for me as a surgeon, typically patients who are stage 4 are not typically operative candidates. So the discussion with those patients are difficult. They're emotional. Really, I think the patients at that point really want to see that you understand as a physician. They want to see that you have some compassion, that you'll work together in order to try to help slow the progression of disease or switch our focus to more comfort, and at least have quality of life for however long it may be. So those are difficult conversations. And then if a patient is progressing even on treatment, chemotherapy, radiation, or they have recurrence of cancer, I think at that point, again, showing some level of emotion or compassion for the new diagnosis, and then ultimately giving them some options. Sometimes there are second line treatments that we can use in order to try to help slow down the progression or regress the tumor. And then sometimes there may not be any further treatment options. And then we would move, again, our focus more to palliation and comfort. But I think the key really is communicating and then showing compassion towards the patient's situation.
What are some of the common symptoms of a lung cancer patient who has non-small cell lung cancer?
Yeah, so this is kind of big, at least from my focus, really is on education of the community. And that's one of the key points there is really how can you particularly try to detect it or recognize when you may or a loved one may have lung cancer. It's not easy. Lung cancer, unfortunately, can be very indolent, meaning you don't see many outward signs until it gets very advanced. So oftentimes it is detected very later in the stage. So, but some of the signs that one may detect really is coughing, particularly coughing up blood, a chronic cough that just won't go away despite maybe antibiotic treatment or time. Weight loss can be a key factor in patients who have advanced stage lung cancer. Sometimes chest pain or chest discomfort, especially if the tumor is large and pushing on the rib cage or the chest wall. Shortness of breath. Sometimes these lung cancers can cause collapse of a particular part of the lung. So therefore you don't have as much of your lung capacity as you once had.
Are there any lifestyle changes you would recommend to a lung cancer patient, and why?
Oh yeah, probably one of the biggest lifestyle changes really is smoking cessation. We know from years and decades of studies that smoking is a big contributor to lung cancer, not just lung cancer, a whole host of types of cancers really are exacerbated by smoking. So I think smoking is one of the biggest things that I can say to the community really in order to help reduce the lung cancer incidence in the U.S. population. Some of the things are environmental, particularly people who had certain types of work environments in the past, or military personnel who've been exposed to asbestos or Agent Orange, or painters in the past who've been exposed to asbestos. Sometimes those agents can contribute to lung cancer. But those are really the main things I could say. The other thing is, I think it's important, particularly for a surgeon, really, I think it's important to develop some sort of and this is how communication ties into it. Really, it's important to develop some sort of rapport with the patient, kind of some sort of intimate relationship or rapport with the patient, because essentially the patient is giving up some of their control to me, and I want them to trust me, to allow me to do what I think I can do best, which is operate and remove the cancer. And in order for them to trust me, I think I have to be able to communicate effectively to them about why I think surgery is the best route. So I think the trust factor is important, and I think the more that you can communicate well to the patient, the easier it is for them to develop the trust with the surgeon to allow me the opportunity to help them.
How do you or your family remember or represent his life as you continue on?
Well, there was so much positivity in the whole experience because there was a great relationship and a great faith. And so we felt peaceful that the suffering was over, and we felt hopeful that life went on. So in that regard, we all feel kind of a obligation to live our best lives from here forward. And that would be the best honoring that we could do. And also to just share with other people the experience, encourage people, and never give up, always believing that you're giving it your best every day. It's worth it to take care of the person who is afflicted, and as much home care as you can, but realizing that it affects the whole family, the disease.